going to hand back to Belinda. Thank you.
Right, thank you. I think there were more questions online, but we'll get back to those who have posed a question to our panel. Right, we're moving on now to our discussion panel, and we have got some people joining us from online, so I'm looking to my indicator at the back there, and I'd also like to invite up Tracy Roos, who is the CEO of Age UK for Cornwall and the Isles of Scilly, who is going to chair this session, and Mark England, who has got a very long title, the Head of Procurement Maintenance, something like that, but he's from Coastline Housing and he's played an enormous part in our partnership here at Smartline. So if you'd like to come along. And hopefully we will then be joined by Chris Jones, who is part of HomeLink ACO. So they have been in discussions with us about use of our data and future projects around environmental sensor monitoring. We also have Professor Karen Morrissey, who used to be part of Smartline. She's now an honorary professor of Smartline, joining us from the Denmark Technical Institute. And we also have Helen, that we heard from earlier, from the Good Things Foundations. So hopefully, fantastic, lovely to see you all, and welcome. So this is really a bit of a free-flowing question and answer. It might put PP panelists on the spot, but I can hand over to Tracy if you like, or we can just field the questions. But
yeah, just field the questions.
Are you sure? Okay, so I guess it's quite broad. So if there's anyone who'd want to raise their hand, or if there's anyone coming through online, then Simon can pose your question for you.
While we're waiting, I'd just like to say what a great event, everyone. All the Smartline team and everybody that has joined in. It's been really engaging to watch it online, so I can only imagine what it's like in the room.
Thanks, Karen. I have a question for Mark and Chris from their perspectives. I just wonder what their biggest take-home has been from the work that Smartline has done and the opportunities of the environmental monitoring for organisations like housing associations and potentially larger landlord organisations.
I can go first if that's okay. I'm quite happy to do that. Yeah, very broad question, but I think one of the real take-home things for me was that we have loads and loads of data. We're a landlord with loads of information about our homes, our customers. We understand them, we communicate with them, but actually this filled a huge gap. And we really didn't know what was going on, and that's not deliberately being controversial. You just don't know what's going on in people's homes sometimes. That could be a leak through a roof that's causing condensation, mold growth. Right through to their social or their financial sort of stability. And being able to gaze, as I said many years ago, as an asset manager, to be able to look across all of those properties via a dashboard and to see the properties that appear to be performing well, and then having that social interaction with them, is massively, massively valuable. And I think it's not very far from being the norm. I'm sure that's what will happen. I think this whole project has been so innovative and has got so many different outputs that a lot of landlords must be thinking about how do we finance this? How do we make this happen? How do you make it business as usual? Because it is the missing link to a certain extent. I know there's out there at the moment, there's lots of conversation around sort of mold and the impacts of that, some really sad cases, and they are avoidable. And with the technology in homes, you can stop that sort of thing happening. But if you can't see it, then your asset database isn't going to tell you. Home visits by other individuals isn't going to tell you necessarily. It's not reliable. One thing with the technology is it's super reliable. You can't bend it, you can't pretend it doesn't happen, but it brings some new responsibilities. And I think we've been clear all the way through that once we know something, you can't push it under the rug and pretend it didn't really happen. It makes it very, very real, and it means that we have to deal with it. And I think that is really good. I think it's really open, really honest, And I think that if every household or every landlord adopted the technology, wouldn't it be a really honest place to be and publish it and explain to others what you're doing about it, rather than sort of leaving those people hidden?
Yeah. So I think from my side, so takeaways from Smartline, I'd say the big thing, from seeing a lot of presentations with you guys, is the sort of, okay, yeah, you're doing something innovative and, doing some research around, new technology, but really it's all about the kind of key challenges and improving people's lives. And as was talked about earlier, and some of the successes that Smartline had was really the relationship with the people on the project. And I think that it's how you kind of scale that, and really recognizing the importance of that is something that is a big takeaway. And then there's obviously just in general, Smartline and Coastline next to one of the first sort of applications of this kind of thing quite early on, and there's been a lot of development in this space since then. In terms of benefits to landlords, so from our experience of scaling this technology, I think we're just about to hit 160,000 IoT devices in social housing now, and it was like less than 1,000 18 months ago, sort of thing. So it has really scaled quite significantly lately. I'd say the main two use cases are sort of it all kind of feeds back to making sure homes are healthy, and that your the people at the end of the day. And the two kind of things I'd say that are driving it are obviously the major issues around damp and mold, which is just continuously in the news for all of the wrong reasons. The ombudsman with the spotlight on mold report and new powers to the regulator. It's just something that's just a huge amount of pressure. It's clearly just going in one direction, and a lot of people are spending a lot of money doing like full stop condition surveys and all these kind of things. And it's just a really obvious application of this technology. And then the other side of it is on sustainability. So a lot of the like PAS 2035 and the retrofit standards you have a kind of requirement for monitoring, to understand the performance of homes from an energy efficiency point of view. But actually one of the main reasons is to make sure there are no unintended negative consequences. So obviously making a home a lot more airtight and energy efficient can actually cause bigger issues with things like damp and mold if it's not built correctly, so you've not got the right kind of ventilation. But and this kind of feeds into the digital inclusion discussion in some kind of ways in terms of new technologies, is if you're putting heat pumps and complicated ventilation systems into homes where people are very much used to using a boiler and just a really simple thermostat and not needing to ventilate because it was a little bit drafty and you wouldn't have to worry about air quality or moisture levels. Quite often you have problems there. So and there's sort of like there's a requirement to have it in PAS 2035, these sensors. And I think in Wales for any retrofit, it's a like the basic minimum requirement is to have sensors. So it is moving very much in that direction. So I'd say they're the main benefits, but it's clearly across the board really. Energy efficiency, being able to identify fuel poverty, savings in landlords, in terms of efficiencies around compliance processes and all sorts of things. But I'd say they're the main two drivers.
Hi, it's Richard George from a company called HLPS. It's a question for Mark, really, and the team. You've probably heard this before, Mark. Slightly inspired by a recent Smartline online seminar around heat on prescription, which I thought was really interesting, because if the BRE are saying that 1.4 billion is a cost to the NHS for poor housing quality, and Asthma and Lung UK are saying 1 billion is the cost to the NHS through asthma and respiratory diseases. And I think I saw on one of the slides today, 600 million cost to the NHS for poor housing quality. If you're getting this data, isn't there a golden opportunity here to be able to analyse what is happening to the residents inside and what is the cost to the local NHS services. And if it would be possible to spread that across the 60,000 that I think I didn't catch the name of the gentleman on the presentation was talking about the sensors in the properties. If you're able to collect data on such an extensive scale, surely there could be a cost to the NHS applied to the damage that's caused to the residents through not having, comfortable, healthy homes. And that would be a very, very slick political argument to ensure that budgets are placed in appropriate positions, as they're trying to do with the Heat as a Prescription service in Gloucestershire, I think it was.
Yeah, so I'll pick those up in various bits, but overarching the actual the cost of the technology, and once you start to look at those costs, in the social housing or just a private housing environment, isn't actually very much. The implications of not having the technology and not managing that household or helping them to manage themselves, and also dealing with the sort of the bricks and sticks, the repairs, the maintenance, and all the other things that go along with being a social landlord. If you don't do that, then there are a lot of other risks sat in the background, including disrepair surveyors. The health and well-being of your customers has got to be absolutely at the top of that. And there are costs to those organisations as well. And yes, a huge opportunity, I would have said, for a wider collaboration to actually start rolling this technology out in every single home. It doesn't have to be just social housing. It doesn't have to be the private sector. It can be absolutely anybody can use this technology to look after their own health and well-being. But if you can link it up with the bits of information like we've done through the dashboards, the customer dashboard, so they can see what's going on in their property and click a link, it's really quick and easy. It doesn't need a huge amount of sort of digital dexterity, I'd call it, to be able to click a link and it'll give you advice and guidance about your house being slightly too cold, or is there a high humidity in there, and here's some advice on how you might avoid that. But I think it's really interesting, and I think the solution's really here. It's really very obvious. It's about sort of nudging it to the next sort of level and saying this is the norm. There is an opportunity pending at the moment, so in social housing in particular, and I know they'll roll it out across probably the private rental sector around this decent home standard and what the new decent home standard looks like. It's clearly going to have an environmental twist. It'll be around carbon and decarbonising stock. But also I hope that they put in technology. I hope they put in something that says that and prove that this property is a healthy environment, because that would make it a really decent home. I don't know if Tracy...
Is there anybody else who would like to respond to that? Karen? You're looking like you're on the edge of your seat.
So I've been listening to everybody's response to the general questions in general, and one of the things that I took from Smartline, just to take a step back, is and the 5 or 6 years that we worked on this, is that you cannot take humans out of the system whatsoever. That there's a huge role for technology to play in terms of developing healthy homes and healthy communities and healthy families, but you just cannot take the human aspect out of it. So when we think about the success of any sort of technology, be it in monitoring mold, in terms of monitoring air environment, the continued lack of people's capacity, householders' capacity to engage with the data or the information that comes from these kind of technologies means that it's not just in social housing that the benefits of technology is not going to be made. It's actually across the private sector as well, and in some ways I have more hope for the housing association, because they have organizations like Smartline, like Coastline, etc., that can have these closed systems that you can have these dashboards linked to the providers. So in many ways I have more hope within the social housing and for people within our Smartline participants than I do in the general population for the benefits that can come from these kind of technologies.
Would anyone else like to respond from the panel? No? Thank you, Karen.
Yeah,
Thank you, Mark.
I could. Sorry, someone else going to say something there. Or, I was just going to say on that heat on prescription, I've actually kind of thought of something similar to that might be just an interesting concept, but something we've thought actively about. We know that the NHS has done pilots where they put these kind of sensors in homes because quite often they'll have people that are sort of taking up bed space, but the only reason they're still there is because they can't be sure that the in-home environment's a healthy environment to sort of recover in or whatever it might be. So they've tested they've had these projects and pilots where they put sensors in homes to make sure that the conditions are right humidity levels and air quality and things like that. Because our social landlord customers can only use this data under the lawful basis for which they're collecting it under GDPR for things that are kind of written in law or to fulfil their obligations. So for making sure that they're compliant and things like that, free from damp, mold, and those sorts of things. It means there's an opportunity for potentially residents, and obviously this would need to be simplified. Talk about digital inclusion. But for residents, so what that means is landlords can't, sell the data. They can only use it for these use cases legally. But there's no reason a resident couldn't sell their data to the NHS to save the NHS money, and then therefore they would have that money to be able to, pay for heating or whatever it might be. So that was something interesting, and the idea really came about because there's been, cases of damp and mold that, where they've got our sensors in, and the residents, got frustrated because they're in a position where their ground floor flat, can't ventilate the house properly for whatever reason. They're drying their clothes inside, which is a known reason for these really high moisture levels, but they can't really dry them outside, and they couldn't afford condenser dryers and things. And we've got landlords that are sort of actively considering weighing up, the cost of a condenser dryer and some support on that front would actually probably save us money in terms of disrepair over a 10-year period. So they're considering doing things like that, and we've no other landlords that have replaced cookers because of carbon monoxide problems and all sorts of things that they wouldn't have done before based on having data. So yeah, there's definitely a lot of opportunity.
I must say, I'm just going to pop in there. I'm not the biggest fan of the commodification of personal data. As much as I use it as a data scientist, and Smartline has done wonderful things with data, I think our research via Smartline has shown that people have a deep, deep distrust about how their data is used. And if suddenly you're putting, if we're commodifying it, that will only make them more distrustful, and actually again bring in these perversities where you have those that can do the things online are getting the value, whilst the others who are going to be the ones that need that prescription or heat on prescription much more than others getting the benefits. So for me, it's more about not the commodification of data, but the integration of data into a system, something like Mark and Coastline have done, where you have a benevolent, if that's possible, we know it is in terms of Coastline, but benevolent, a pair of eyes that allow people and help people to use their data to better their actual health and well-being.
Lara Simon's got some questions from online. Oh, he's got.
Yeah, one question from online, and this is probably a good one for this time, is what is next for Smartline?
Is Emma Bland part of the panel? Because she always has ideas.
Thanks, Karen. What is next for Smartline directly is the project will end at the end of April, and then we'll wrap up for a couple of months. What we have we have a follow-up project starting in January, which is going to be looking at whether sensor technology can help identify health changes in people's health. conditions, so looking at environmental sensors as an indicator of change to allow follow-up for people with particular health conditions, and we start that project in January, and we are waiting to hear about whether we can add a supplementary element onto that which addresses some of the kind of issues that have just been mentioned, about whether we can use this sort of environmental sensor technology with the information going back to the voluntary sector hubs, so that voluntary groups providing services to vulnerable households, whether that's people who are, for want of a better phrase, temporarily vulnerable because they're coming out of hospital, or because they have been identified as being long-term vulnerable, whether rather than housing associations, voluntary sector groups might be able to use that information to direct services and ensure that people don't get lost in the system and so ignored. But in terms of longer term, we would love to continue Smartline and to continue and explore the questions that we've really just beginning to address. Sadly, the funding isn't there for us at the moment, but we are looking for other ways of dealing with some of these challenges, and looking to work collaboratively with as many people as we can. And I think one of the really interesting things for Smartline is, over recent times, we are really starting to understand that internal home environments are important. Up until now, much of the work on air quality has been done on outdoor air quality, and we're only starting to unpick what the connection between poor indoor air and health impact. So there's work to be done on the impact on children's cognition and ability to learn, as well as people's cognitive decline and the impact of poor environments on older people. So there's so much still to be done, everything in between. And yeah, if anybody would like to fund us, we're very welcome, and we'd love to have a chat with you.
And if I can add to that, we have a second project, actually. Helen Dawes, who's not here, but she's also one of the co-eyes on Smartline. She's working on the kind of physio side, so she's actually developing technologies for people to use in homes, which are a part of rehabilitation services, like that are offered by the NHS, but also by other voluntary organizations. And I guess because of the drive for putting health and care out of the hospital and into homes, there is something which is supported by the NHS and organizations which fund research in that space. But I guess it takes a while before these things are picked up at scale, and we're trying to develop things in the intermediate space.
Okay, another one from online. Interesting debate about the commodification of data. The NHS has been referred to not necessarily famous for being IT and data savvy. Are they ready for all of this?
Yeah, I mean, I think it's a good question. I'm not an expert on the NHS, but we've spoken to, we've done projects with them recently, and obviously a user of the NHS as well. I don't think anyone is really, it's always a case of things slowly happening over time. The NHS have clearly got a lot better, in my view, in particular since since COVID and everything in the digital area, in terms of these new ideas and things like that. They're on the same journey that probably social housing is, maybe at a different stage. I saw a few talks from a conference recently where they were talking about this idea of having sensors in homes, and they are doing pilots and things like that, and weighing up the business case. I guess they're finding a way. As far as I'm aware, there's been some advancements in terms of how they collect data and things like that. I think Tim Berners-Lee, the guy who created the World Wide Web, is one of his new company. NHS is one of his customers, and that's all about sort of people owning their data and things like that. So I think they are quite forward thinking, despite probably how they'd appear. Any big organisation is going to struggle to change.
If I may add something to that, I think it's really, the question is quite complex, and in some ways, and then in other ways it's not. For me, the success of using data in any single organization or the technology, digital technology in any single organization, be it in HS or something like universities, is the ethos you bring to it. And simply put, the drive for cost effectiveness and cost cutting that we see in public bodies at the moment, driven, dare I say, by current government politics, means that the ethos to make it successful is not there. Because the way that people are putting, the organizations are working, such as the NHS, it's a way of taking manpower and woman power out of the system, trying to find cheaper ways of doing things, of making really important decisions and actually, or looking after people. And that's not what technology will do. Technology will help you, but it can't be put in place instead of. So if you're putting technology in so that your services your current service base is augmented, then maybe yes, you have a chance. The NHS would have a chance, but the way it's being done at the moment, it's just another cost-cutting measure, and that is just going to be detrimental to both people's health, but also the idea of how health technology can be used in health and well-being. It's just going to be seen as another white elephant.
Just jumping in, I think that the sitting alongside commoditizing people's data is also informed choice, and that obviously all of us working in digital inclusion know how hard that is, when it's actually pretty hard for the people that we're working with to learn how to send an email, to put an attachment on, how to do a Google search. So I think it is really that is an area that we need to have more work to really work out how can we communicate what's happening to people's data already, right? So if they're already using a search engine, if they're already using an email, if they're already using, if they're already going to websites and clicking yes to all the cookies, then actually their data is being used all over the place already. I know that's different kinds of data. It's not about your health, but actually there's quite a lot of data that's being harvested by commercial entities without really getting any kind of informed consent. They're getting consent. They're ticking the box from a legal point of view, but actually that is, I would say, very rarely is that informed consent from people who are not actually engaged in this area in the way as probably some of us are. So that I think that makes data incredibly tricky, because actually if you ask a normal person, would they like to not have to repeat 5 times what's wrong with them when they go to the hospital, they'd probably say yes please, right? But actually if you say to them, do you want to share your data with the NHS and with other government departments when you go to A&E because you've fallen over because you've had a bit too much to drink on a Saturday night, you'd probably say no thank you. So that actually the way in which data is collected and then used and then reused is so important. I think we really shouldn't. I think in the public sector there's a lot of clever people doing some good thinking about it, but actually I think that it's really beholden upon us, particularly those of us who are helping and training people who are digitally excluded and actually most of the time are quite vulnerable, to actually understand that within the use of the internet, which is mostly a commercial use of the internet, actually their data is going to be used.
I came across a lovely phrase yesterday. We're writing up some of our seasonal well-being. We looked at the well-being of our participants over the year, and we're wondering how digital competency might actually impact or not impact or moderate this. And I was reading a paper, and they differentiate between the difference between technology in terms of button knowledge, which is what we are often speaking about, what buttons to press, and actually that deeper knowledge around the full digital literacy, confidentiality, etc. And we're failing at both, but we're really, really, really failing at the second part.
Is that on? Yeah. Sorry, I can't really talk on behalf of the NHS. That'll be pretty unfair of me, but I think just generalising, for most businesses, avoidance is better than cure. At the end of the day, you really want to try and avoid all the things that we're seeing, in our health industry at the moment, where there's lots and lots of pressure, lots of people going in with all sorts of different illnesses. And it's not all just COVID. And I'm not an expert in health at all, but using this technology, this project has proved that actually, with a bit of influence, with the right organisations, that we can help to affect people's health in a positive way rather than a negative way. We can probably help them sort of avoid sort of longer term illnesses and certainly push that out a little bit further. So there is a value, there is a benefit. So I think from people like the NHS's point of view, it's certainly worthwhile them having a really good look at projects like this and then trying to make some business decisions about where those savings might be. Because if we can monitor everybody's home and advise them the best ways of trying to sort of live in their own environment, then surely that's going to have a knock-on effect and there will be a benefit for everybody.
I'm Anna Nichols, I'm a commissioning officer at Coon Council in Adult Social Care. And actually we were talking now about our mentioned NHS. So we at Coon Council obviously trying to embrace technology as much as we can. We are really at the beginning of that journey, to be fair with you. It was really interesting that what actually you said that, yes, absolutely, we should really always think about humans, about people, and not bringing technology to save money. Well, we are actually in a very difficult position in adult social care because we have got much higher demand and than the budget. We can't support everyone who really needs it. And now also with technology, we are, I think, maybe slightly behind, other areas, not all in England, from this what I've been talking, engaging with other local authorities. How could we embrace that technology in adult social care? How can we actually move on? I recognize there's a culture change, is a lot of change in terms of the data, in terms of the data sharing, governance. It's a lot about developing confidence within our operational teams to actually use data. Because I've had, for example, some people saying to me they are struggling with their smartphones, so let alone using technology-enabled care in their everyday job. Have you got any tips, or maybe someone or some studies or some examples of local authorities that worked really, really well, and it's actually supported, that's bringing that technology to social care, actually supported people in a positive way, and also brought some good outcomes in terms of the council's budget, really. I've got to be honest with you, but we have to balance it somehow. Thank you.
Anyone want to add more to that? I mean, from Smartline's perspective, we are only working with Cornwall Council, so and we understand that there are probably more information that we could do with you to help you understand. But I can understand you're saying that even your social care team aren't understanding the digital technology to then actually get your end users. So it comes back to this, what is digital competency? And it is back to the buttons, maybe, that Karen has just referred to, and Ria before. We don't know what a like button is, some people. So it is back to training and no presumption that everyone's starting from the same level, even though you might not be 67 and living in Camborne and unable to get out to your house. There's people with jobs who are now being faced with new technology, as Emma referred to earlier, with our SharePoint and our Teams and all these things that got loaded upon us when we went into lockdown, that actually it's starting from the beginning and they're taking no assumptions, I think. There's a hand at the back. Oh, sorry. I should look down here, but...
Sorry, I was just going to say, I think that We have a tendency to be completely dazzled by the new technology that's coming online all the time. But if nothing else, what Smartline has shown is that you can, and it's still technology and people still struggle with it, but if we can use this phrase, there's a lot you can do to help people's health and well-being with everyday technology. There are certain digital technologies that have become somewhat ubiquitous. COVID, unfortunately, in many ways has made that true. You have WhatsApp, you have things like Zoom, etc. There's a lot you can do with that. So instead of being completely dazzled by the marketplace, think about how you can build up your capacity with what people are already familiar with. And that was one of the big findings that we had from Smartline. I think it's reiterated through all the presentations that people don't want to learn new things, but they're completely open to discovering new ways of doing things with the things they know. That's a lot of things in there, but I hope you get my point.
Yeah, absolutely. I think I want to support Karen there, and that I think that social care is obviously under enormous pressure at the moment in all sorts of ways. But just on the digital literacy of and using the current digital tools with residents in care homes, for example, and nursing homes, that we do know that there is an issue with some staff skills and staff confidence, and that's a really tricky one to try and address, because that clearly their everyday is very busy, with care, and that we also know that wages are low. I would say though that it's really important to make sure that care workers are upskilled to use the basic technologies, because actually you're never going to be able to bring anything in across the care sector if actually you don't have digitally literate care workers, and so it is really important. But I think I want to just say that I really understand how difficult it is at the moment, and how incredibly challenging. It's very easy to say it, it's incredibly challenging to be able to do it, to find the time. I think my experience of the care sector is that actually COVID has helped quite a bit, where residents and family have been communicating through Zoom, for example, and then it's been a necessity to upskill the care workers in helping residents to use tools like Zoom. So actually it's been a sort of helpful a snowball effect, where necessity to communicate with the outside world has actually meant that people have been upskilled, and equipment has been put in, and Wi-Fi is now much more common across the whole of care home. So it's slow, but it's absolutely essential, I would say, as increasingly people live all over the place, far away from family, and actually making sure that we do have that connection with them is so important.
Yeah, I think just something to add to that quickly. I think even the kind of technology, if you talk about telecare technologies as well, even those kind of basic technologies that are being used now, without thinking of new ways or different sensors and things like that, even just kind of push button sensors and the sort of infrastructure that supports them, from connectivity to how alarm receiving centers work, all of that, I think over the next decade is going to get a lot cheaper. There's kind of platforms in Scotland, for example. There's digital office there is doing projects around opening the whole thing out, because there's a handful of big companies that are incumbent, and it's quite expensive, but it doesn't need to be, and I think that's going to change a lot over the next decade or two. So hopefully there's savings that can be made, even just supplying the same kind of features with those technologies, which could, I think, go into increasing the wages of people and getting better people to be able to operate the alarm receiving sensors or the actual care workers themselves.
Add to all of that lots of the barriers that we face are cultural and behavioural. They're not necessarily about digital or data, they are cultural. And when during COVID we saw people come together in a different way and step back from those challenges around data sharing and around who does what. And as we've moved out from COVID and budgets are getting tight, we're seeing people default back into those culture and behavioural norms, unfortunately. So there's something about shared intent. There's something about starting small and being able to work up together. But there's also something about prevention. I think one of the things that Smartline has demonstrated is that the data is very useful in a field of prevention. It's useful to look at and predict. That is not what we do in health, and it's certainly not what we do in social care. We don't predict, we don't anticipate, we don't prevent, we deal with crisis. So there's something about really understanding where data can help us get ahead of the curve, because all we currently do is circle the orbit of urgent care and crisis. We don't get beyond that particularly. So I think there's something that we can learn from Smartline about actually how data can help us predict and prevent, not just deal.
Yeah, I think just so one quick thing on that, that's all recently, because a lot of, we talk in this sector, there's about compliance and obligations and things like that, but the thing that drives us really is that the reality of how the indoor environment can affect people's health. And I saw recently a New Scientist article that was suggesting air quality is kind of focusing around outdoor air quality, but particularly PM 2.5, being a kind of one of the leading causes, or like a sort of part of something like 25% of dementia cases or progression of dementia. And we know that PM 2.5 can be much higher indoors if it's not ventilated correctly and other things. So it's probably not too far away we're going to suddenly realise that these indoor environments really affect things like dementia and the progression of dementia. And as dementia progresses, if people are living in their homes, then the amount of technology that's required, or people, or number of visits, vastly increases, and that's the sort of cost side of it. But obviously, the reason you want to be able to reduce that is for someone not having severe dementia. That's why we're really doing it. But obviously, as has kind of been discussed, the cost side of it's it's a big part of it, because everyone has people that are actually doing this have very difficult budgets and difficult decisions to make, and that's an unfortunate reality.
Thank you. I think we're running out of time now for more questions. So thank you to those that have posed questions, and thank you very much to our panel.